Delegate Michael Hite, Vice Chair of Health. Good morning, Michael. Sir, how are you?
Good morning. Good to be here.
Vice Chair of Health, he's got to have some tips on my dry hands, right?
He should, right?
Yeah, keep moisturizing.
Hey, Mike, before we get started, today was not my day to come in, and Rob asked me would it be available. I said, nope, Rob, I need to sleep in today. He said, well, Mike Hite's going to be on. You can ask him tough questions. I said, I'll be there, Rob. Regardless, I'll be there just so I can ask Mike Hite tough questions.
He said,
I look forward to it, Bill.
He said, I missed the Badger on Friday mornings. I got to get my Badger
Got to
fixed.
get my Badger fixed.
Hey, your mom, in the last segment, we spoke with Chris Miller about the relief efforts he's rounding up in the southern part of the state. And your mom posted something in our Facebook section about something that you and she are working on as well. Mike, you have any more information on that?
Yeah, just we're trying to get some supplies to the people down south, and our coordinated effort is to use the services that are already down here, whether it be Walmart or whatever, and just ordering stuff through Walmart and having it delivered to the places that can get it out to the folks who are in need, rather than trying to organize a whole bunch of people in Berkeley County, which is going on as well, and that's great. I applaud them. I think John Hardy's leading an effort up there to get some supplies down there. But all of that takes a lot of coordination, and it takes somebody to drive down and deliver all that stuff. So we've taken a different route, and we're just trying to, raise some funds and just order the stuff and have it delivered.
All right. How do people contribute to what you're doing?
Well, they can contact me directly, or they can contact Doreen, either way, and we'll see that those funds are directed towards the efforts down there.
Very good. Let's talk about the biggest issue of the day that I see, and that is the vaccine bill that worked its way through the Senate. And the Health Committee had a chance to look at it yesterday. Mike, what did you see, and what changes, if any, would you like to make on this bill, if indeed you're going to work on it to bring it to a vote?
Well, I don't know that I see any real changes I'd like to see on it now. And I'm a data-driven guy. I sort of look at data when I'm trying to make decisions down here. So I look at other states and what they are doing and how is it affecting them. And right now we're with, I think, 4 other states in our restrictions on vaccines and how we have to have them. So we're in line with California and New York and Connecticut and I think Maine. So very blue states. And then you look all around us, and they have a much more lax regulatory system on vaccines. They allow for religious and or philosophical exemptions, and I just think we need to explore that. There's also a lot of testimony that we get down here about the true effectiveness of the vaccines, and people who are vaccine, I guess what they call hurt or injured, and how they are affected by vaccines. And there's been some horror stories. So I think in the end you have to weigh the good that vaccines do versus some of the bad things they can do.
According to the Metro News article, almost all states except California, Mississippi, and West Virginia allow religious or philosophical exemptions for school vaccines, granting
That's
parents
correct.
the ability to opt their children out of vaccinations based on sincerely held beliefs. That's from the Metro News article on this issue that you guys are looking at for today.
If I could, just a second.
Yes.
Of that, Rob, I think they grouped the two, religious and philosophical. I believe there's only 11 states that allow philosophical exemption.
Philosophical, and this bill is also a philosophical exemption as well. Am I correct?
Yes.
Yes.
Medical, religious, personal belief, philosophical. Whenever So those that allow all three, the medical, religious, personal belief, around us are Ohio, Pennsylvania, Virginia, and the District of Columbia all allow all three. The rest of the states around us allow medical and religious.
Is there?
We're just medical only, but there's a lot of testimony that we're hearing that we're not even allowing medical in some regards. That it's extremely difficult to get medical exemptions here in the state of West Virginia.
Is there data that you've seen in regards to those other states that you mentioned that have exemptions as to what percentage of the population is getting vaccinated regardless of the ability to get an exemption?
I heard some testimony yesterday, and it's somewhere in the 2 to 3% are unvaccinated in those states.
2 to 3% are not vaccinated in those. So the vaccination, the voluntary vaccination rate is still very high, is what you're saying.
Correct.
And is there any information that you are getting in regards to any outbreaks in states around the country?
Virtually none. I mean, you hear about some here and there, but when you look down into it and find, so like there was a case of polio in New York that somebody brought up, but they're just like us. They only have medical exemptions. But then they find out that particular case of polio was contracted from the virus, or not the virus, but from the vaccine itself. It wasn't a wild strain, and that happens from time to time. We've heard in Texas that there's some measles outbreaks, and that all of the individuals with measles were hospitalized. And the hospitalizations were not because they were serious outbreaks, but to isolate those individuals so it didn't spread anymore. And there's some indications that was vaccine-related as well. So I think when we look at these outbreaks, we have to determine what was the cause of it, and are these vaccine-related, or are these wild strains that are popping up?
Mike, you've been following this probably closer than I have, but in the Texas, New Mexico, where there has been an substantial outbreak of measles, the majority have not been vaccinated.
That's a terrible question.
No, I guess it's a statement. I'm sorry, it's a statement, but it's yeah.
I'm just kidding. Now, you've been getting too much.
He's been getting a lot of great questions. Rob. Yeah.
I was going to say, does that knock one of the great questions off?
I think it knocks two of them off, actually.
I had to knock him down a peg there.
Come on, Badger. You're supposed to be. We're supposed to work together on this.
He's helping me.
Okay, but I guess you're right. It's a lousy question, Mike. But let me rephrase it. What we've seen in New Mexico and Texas have been the majority of the measles cases have been unvaccinated. Does this support the data that you've been seeing?
Some of that, but then you have to wonder how much of those are cases of people illegally coming into the country across those borders and adding to that. So, like I said, when you look at the states who have lax vaccination laws, like Texas and New Mexico, the majority of people, the 97, 98% are still vaccinating. So when you have these outbreaks, you have to wonder, is it because of unvaccinated people coming across the border?
Another question. Again, I'm picking up only what I see Metro News and discussion around this table, but I get the impression that the medical community is in opposition to the Senate bill. Is that correct? Because of the herd immunity aspect.
The vast majority of them, yes, I would say that the vast majority, or the outspoken medical associations are against this. But it's interesting that, when we hear testimony in the House committee, I was surprised by how many of the doctors and nurses are the ones that are coming in and testifying that these vaccines, that there's a problem with our vaccine system and the efficacy of these vaccines and the testing that was done on these vaccines. It's surprising some of these vaccines were approved after 3 days of testing. I mean, that seems odd to me. And then there's been no additional testing since they were introduced. A lot of people talk about the polio vaccine. The polio vaccine, from its introduction, has been changed several times due to the injury rate that it had early on. Now, it saved a lot of lives early on. I'll admit to that, but it also hurt a lot of people as well because it wasn't properly tested.
Mr. Miller.
Is there a particular situation that is kind of driving this bill at this particular time, or what is really behind this effort for this vaccine bill?
Well, I think the majority of it is the individuals who want the religious and philosophical exemptions, that there are people who are homeschooling, and that's the reason. But they want to be able to allow their children to go to public school or to play in sports without having the vaccines that some of them feel are dangerous in some cases. And some we heard testimony from yesterday had adverse reactions to vaccines, terrible reactions to vaccines, and could only get medical exemptions for like 2 weeks, which obviously isn't going to allow them to go to the public schools and register. And they're saying that it doesn't matter what the exemption is or how long the state gives them an exemption. They're not giving vaccines anymore to these individual kids because of the reactions they're having. We had another woman say that she got a federal exemption when she lived in North Carolina, and then when she moved to West Virginia, the West Virginia would not accept the federal exemption and denied her exemption on a medical basis. So I think there's lots of things we have to fix here in West Virginia. One, we already have medical exemptions, and we're doing a poor job of allowing them for those people who seriously need them. And the other is, if they want religious or philosophical exemptions, we're looking at the other states around us and saying that that's not that big a deal.
It's interesting, though, you bring up we do have the medical, and yet you give us an example of a lady that got a federal medical exemption and the state wouldn't accept it. So is there a chance that even if this bill passes, that in some way some state agency can still look and be like, well, I'm not going to accept it?
Yep, absolutely.
So what do you do in that case?
These bureaucracies need to be cut off at the knees in some cases, need to be restructured. And when you have agencies that are not doing what their role is designed to do, then we need to take a hard look at them and get rid of these individuals who are making these personal decisions based on their own beliefs rather than what the law says.
Mike, could we change subjects to CON, Certificate of Need?
Before we do go there, a couple of questions I wanted to bring to your attention from some of the comments that we had. Why not allow tracking information as to who or how many people have vaccinations versus ones who don't? I guess that question offended him. That might have been worse than your question, Bill.
Mine was not a question. So he pointed out to me.
I thought, like a good Jeopardy contestant, I thought I'd put mine in the form of a question.
No, as soon as he called me out on it, I realized it was a statement and not a question.
But
my bad.
A very offensive question, apparently. Mike was on his landline, and I think he accidentally cut himself off, but he's back now. Thank you, Dylan. And Mike, I'm sorry if that question offended you. I didn't mean to make you hang up on me.
Yeah, that was a terrible question.
Just awful. Just very intrusive.
I'm sorry. Could you repeat it again?
Yeah, we were asking you to tell us why you're the greatest human being ever, and then you just hung up on us.
I was not asking
Well,
that,
I
Mike.
thought that was self-explanatory.
Yeah, the question is in regards to tracking how many people, what percentage is getting vaccinated versus not getting vaccinated. Any idea on how to implement tracking of implementation of vaccines or exemptions?
Yeah, that's a good question. I think they should be able to track the exemptions pretty simple. But if somebody doesn't, the only way they track it now is if you register for school, and that determines how many people are getting vaccinated or how many people are asking for the exemptions. There's no other way to track it right now. We would have to devise some way to do it through the health department, I think, maybe through the hospitals and saying, all right, we've had this many children born, and where are they in the system? I'm not sure how we would do that.
Mike, do you know, do they track those now? Like you mentioned, if a family decides they want to homeschool their children, they don't necessarily have to go through the vaccination process that would register them into the public school. So is there a way of even tracking children that aren't being vaccinated now because they're not in the school system?
No, not currently.
But you can't go to the public school system unless you have a medical exemption right now if you're not vaccinated, correct?
That's correct.
So that's go ahead, Bill, with your certificate of need.
Yeah, we're in a short period of time we have left, Mike. A certificate of need. I understand there's some movement on this with the legislators.
No, it died last night. There is no movement.
Okay, so it did die. So I think I'd heard that as well. I consider that to be movement. So it's not going forward. So there'll be no certificate, not to repeal the CONs. Correct?
Not in that bill. Now, does somebody have an opportunity to offer another bill and it could be brought up later in the session? Absolutely, anything's possible. But the governor's bill died last night in committee.
Was it too broad, Mike? Does it need to be more narrow in its focus?
No, I think it was a decent bill. For whatever reason, there were some individuals who flipped once they got into committee. That we had the votes to get it out of committee. I don't know if it would have passed the floor. We hadn't determined that yet, but we had determined that we had enough votes to get it out of committee. And then for some reason, during committee, there were 3 individuals that changed their vote.
How would you have voted on it, Mike, had it come to a full vote for thumbs up or thumbs down on the law change?
I was a thumbs up. I was for the bill as it was written. It had the so-called carve-out for hospice in it. And, again, I'm a data-driven guy, and the data says that of those states who have repealed CON, that there has been virtually no difference at all, even in the rural settings that everybody was concerned about. So if the data says there's really no advantage to CON, then I don't know why we have it.
Berkeley Senior Service. Oh, go ahead, Mike.
The federal government has been indicating since the 1980s that we needed to get rid of it.
Berkeley Senior Services have been asking for a carve out as well if it was going to get passed. Did that get any attention?
No, not the senior services, and I know home health wanted some carve-outs as well. They didn't either. And even hospice didn't get a true carve-out. What they did is they kept their CON, but they put a moratorium on hospices, which means they were not going to – they couldn't offer another CON for hospice anywhere. So that essentially eliminated anybody coming in and competing with hospice.
Very good. And we're down to our final 30 seconds here. Mike, anything else you're working on today of note?
Today's actually a pretty easy day. We just have some hearings in the Human Services Committee on some relatively easy bills. I don't even remember what they are. That non-controversial stuff. So I expect an easy day today.
Michael, have a great day. We appreciate your participation in the program today.
No problem. Thanks for having me.
Thanks, Michael.
Good information from Delegate Michael Hite.